Welcome to our introductory session on integrative psychiatry. Today, we're going to explore a holistic approach to mental health that bridges the gap between conventional medicine and natural therapies. Hi everyone, I'm so glad you're here. When we talk about mental health, it's often easy to focus only on the surface symptoms. But true, lasting healing comes from looking at the whole person. In this lesson, we're going to dive into the core fundamentals of integrative psychiatry, a path that honors your body's innate ability to heal while using the best of both conventional and natural medicine. Our journey today will cover four main areas. We'll start with the core principles of holistic care, then explore the therapeutic order that guides our clinical decisions. We'll also look at how we assess new patients and finally, how we build a comprehensive, personalized treatment plan. At the heart of our work are a few simple but powerful principles. First, we believe the body has an innate capacity to heal itself when given the right opportunity. Second, we see the body as an integrated whole. An imbalance in one system, like digestion, will inevitably affect the rest of the body, including your mind and mood. In this view, symptoms like anxiety or depression aren't just things to be suppressed. They are actually calls to work on the basics: your diet, sleep, movement, and even your spirit. Our job as clinicians is to identify what's inhibiting your healing and remove those obstacles. To do this systematically, we follow what we call the naturopathic medicine therapeutic order. Think of it as a pyramid. We always want to start at the foundation with the least force necessary to achieve results before moving up to more intensive interventions. At the base, we establish the foundation for health. We move up to stimulate the body's self-healing mechanisms and support weakened systems. Only when necessary do we move into synthetic symptom relief or high-force interventions to suppress pathology. It's about being as natural as possible, as often as possible. Now, you might wonder, when is holistic care the right choice? Safety is always our first priority. We use conventional medication first if there's an immediate risk of harm to oneself or others, or if a patient is simply unable to function in their daily life. Integrative care works best when the patient is stable and ready to engage. Interestingly, research shows that patient preference matters immensely. In one major study, 60% of patients preferred a combination of therapies. The most important finding was that patients who received the treatment they actually preferred experienced the quickest results, regardless of what that treatment was. This is why our first visit is so intensive. We don't just ask about your mood, we ask about your childhood, your daily schedule, your stressors, and even your digestion. Like an old gold prospector, we have to dig through a lot of sand to find those few particles of gold that explain your unique health story. To back up what you tell us, we use comprehensive lab testing. We look at blood markers, hormones in saliva or urine, and even the health of your gut microbiome. These tests help us see the invisible factors like nutrient deficiencies or inflammation that might be dragging your mood down. Sometimes your symptoms tell the story before the labs do. For example, if you're feeling worried and obsessive, it might point to low serotonin. If you're struggling with motivation and focus, it could be low dopamine. We use your experience to guide which tests we run and how we interpret the results. By understanding these biochemical markers, we can choose very specific supplements and lifestyle changes. Instead of a one-size-fits-all approach, we're tailoring the prescription to what your specific brain chemistry needs in that moment. Once we have the data, we build your general treatment plan. This isn't just a list of pills, it's a comprehensive strategy covering medical follow-ups, sleep hygiene, movement, your environment, and even psychological work like psychotherapy, which has been shown to have lower relapse rates than antidepressants alone. We focus on the pillars. Sleep is non-negotiable. It's when your brain cleans itself. Exercise stimulates the growth of new brain cells. and nature, or forest bathing, has been proven to lower cortisol and inflammation. These are the powerful natural medicines that form our foundation. Finally, for those already on medications, we start with natural therapies first to build strength. Only after these treatments begin to take effect do we slowly and safely work with your physician to taper or wean off medications as appropriate. It's always a slow, careful process. Integrative psychiatry isn't about choosing one side over the other. It's about synthesis. It's about using every evidence-based tool we have to ensure you aren't just not depressed, but that you are truly thriving in mind, body, and spirit. Thank you for joining me for this first look at the fundamentals. Remember, your health is a journey, and taking a holistic approach is one of the most empowering steps you can take. I look forward to diving deeper with you in our next session. To recap, remember that your body wants to heal. Start with the lifestyle basics. Use lab testing to personalize your path, and always prioritize safety in your treatment decisions. In our next part, we'll explore the science of sleep and movement in much greater detail. See you then.